A lot of great questions and comments and certainly disagreement here, but we're also getting a lot of comments from our viewers at home. So let's check on our social media desk. Jana, what's the latest?
Well, Mark, to be honest, not to offend our panel, but we have people on both sides of the issue questioning the credibility of our panelists. Is there more, I guess, hidden agendas here? That's one big theme that we're seeing. There's so much. Who do we trust? How do we know who to trust? That's what we're seeing a lot on Twitter. I want to get to a comment from one of our older viewers on Facebook who wrote to us and said, we had measles and mumps in my house and a quarantine sign on the front door. Many parents now are a generation separated from this, so they have no clue what it was like to have to deal with such a terrible illness, somebody who had to live through one of these epidemics. We wanted to bring in a question from one of our Twitter followers who's asking, how about explaining SV40 virus and contaminants in vaccines? Now, to be honest, I had no clue what that meant. And so I was just doing some Googling, and that was a virus that was found to be in some polio vaccines back in the 50s, I believe, if I can pull it up really quickly. So I was wondering if our panel could talk about this SV40, getting into polio. It seems to be a cancer-causing, it could cause cancer from what I'm reading. And there was that fear. That's one area of fear where I think some people, where it comes from. So wondering if the panel could kind of explain whether this is a valid concern for current vaccines.
And let's bring it a little more up to date, Dr. Flanagan. About a decade ago, there was concern about things like the flu vaccines. There were some issues about availability and supply and so forth. How big a problem is this in terms of the safety of any kind of vaccine or availability? Are we single sourcing these to such a small group of pharmaceuticals that we have problems getting what we need?
So, as I alluded to earlier, it's not perfect. The quality is good. The quality continues to improve. No one points at the automotive industry and says, you used to make cars in the 50s without seatbelts and you're horrible today. The safety gets better. We get much better at identifying what it is about that virus or that bacteria that our immune system recognizes, and we can pluck that out and create a vaccine around that without involving any of the other things. How we make vaccines is dramatically better. It has changed significantly, so we don't have to worry about some of the viral contaminants that used to be there. We no longer depend upon some of the preservatives that used to be in there that would raise some concerns. In today's vaccines, a generation from now, they will look back and say, wow, that's what they did? Well, yeah, it is what we did because it's the best we had at the time. You can't just not do it today because tomorrow will be better.
Dr. Nass, you agree?
Vaccine contamination has been an issue since vaccines were first developed and continues to be an issue. FDA a few years ago had a conference on how to detect mycoplasmas in vaccines, for example. And mycoplasmas are bacteria without a cell wall, basically. And viral contamination is still an issue in vaccines. That is why vaccines contain things like formaldehyde and thimerosal to try to kill off any residual contamination. They're made with substances like fetal calf serum or cow blood and things like that. Some are made in monkey kidney cell culture. And so SV40 was in more than polio vaccines for a long time, and we don't actually still know whether that had an adverse effect or not, but it shouldn't have been there. And I'll just give you, since you asked about the credentials of the people on the panel, I brought in a lot of articles from pretty credible sources to show that I'm not making anything up. So for example, in 2013, this is from the FDA website, there were recalls of 5 different kinds of vaccines: the Gardasil, meningitis, hepatitis B, typhoid, and MMR. Not all of them, but lots of, certain lots, because of problems with manufacturing and in some cases contamination. About 5 years ago, we were buying flu vaccine from a plant in the United Kingdom, and there was bacterial contamination of a significant proportion. So tens of millions of vaccine doses were contaminated. And Here in the United States, the regulatory agencies didn't want to stop that shipment because we wouldn't have enough flu vaccine for the country. And finally, the UK government stepped in and stopped the transfer to the United States so we wouldn't be using it. So the problem is you can't necessarily trust the regulatory agencies to do what seems like the scientifically right thing, because they're run by policy people and political people. Another very good example is the 1976 swine flu vaccine program. It was one person died at Fort Dix, but he was also on a forced march. And for various complicated political reasons, the federal government decided to start a vaccine program for the entire country against swine flu, thinking it might be like the 1918 epidemic. They got together with manufacturers. Manufacturers wouldn't do it unless liability was waived. 45 million Americans were vaccinated for a disease that never appeared. So over the year since that guy died in Fort Dix, they started this whole process and continued it and vaccinated 45 million people with no disease, and there never was a disease. And of those, about 400 got Guillain-Barré, a paralyzing illness, and about 30 died. So we have a history that politicians and even health care politicians make bad decisions.
And I'd like to bring Dr. Mills back to the conversation.
Well, I would actually disagree on several of those points, including the swine flu. I think that has been very well studied and showed that the incidence of Guillain-Barré, for instance, after the swine flu vaccine was no different than it wasn't caused by the vaccine. Or
You
anyway,
haven't read the literature.
Well, I have read quite a bit of the literature, but I also think it is important, as Dr. Flanagan said, that we focus on improving the quality of our vaccine supply, as I believe it is a very safe and high quality vaccine supply, but it always can get better. However, I also think it's very important that we focus on the diseases that these vaccines are preventing. Personally, I have taken care of children with measles, both in East Africa and in the last major outbreak in the United States before this last year, which was in Los Angeles and a lot of the western states around the year 2000. I'm sorry, 1990. Yeah, anyway, somewhere I'm trying to think what decade it was. And it was at that time, at that outbreak, that we realized that children needed 2 doses of MMR to protect them, fully protect them against measles, rather than 1 dose. And we also didn't have the Vaccines for Children program, so that a lot of children in the United States who had low incomes, their parents had low incomes, or they had Medicaid insurance, could not easily access vaccines. So we had this outbreak, and we learned from it. I saw personally a child very tragically die of measles in the United States back then, who was unable to access vaccines. I also have seen a number of children back then in the 1980s and into the early 90s with something called Haemophilus influenza B meningitis. When I did my training in Children's Hospital, Los Angeles, you didn't have to spend more than 24 hours in the emergency room, but before you'd have to do a spinal tap, a lumbar puncture on a child with meningitis. And when that vaccine came out about 1990, we went from really daily seeing children with meningitis to it almost being eliminated. It was astounding, and it was due to that vaccine. And yet many of those children who had meningitis died of meningitis, or they had hearing loss or severe neurological issues as a result of the meningitis. Though some of those children are alive today, and I tell you, if they were here now, they would say, I wish we'd had access to that vaccine. I could go on, but I think it is very critical that we not just examine the quality of our vaccine supply, but also look at the tremendous success that these vaccines are having, not blindly, but we do need to look at these diseases as well that they are preventing.
WGME 13 is fortunate to have a wonderful news partnership with the Bangor Daily News. And joining us this evening is Miss Jackie Farwell. She's with the Bangor Daily News, and I think you have some questions you'd like to ask of our panel this evening.
Yes, I'd like to ask about the public health approach to vaccination. There's some new research indicating that it's not as effective as it could be, and that in some cases the information that's presented to parents can actually deepen resistance to vaccines among parents who are already skeptical. So I'm curious if you think that public health approach needs to evolve, and if so, how?
Dr. Flanagan?
Again, it is very, very difficult because on a public health basis, you're worried about the population and how many children can you get immunized so that those who are immunized don't get sick and those who can't get immunized because of a medical condition, because of a religious belief, a philosophical belief, they're still protected, because if 98% of people are immune, they won't get sick and expose those kids who couldn't be immunized. At the same time, it's a very personal decision, a very difficult decision for a parent at a time when it is not easy, especially if it's your first child. And the child's offered a vaccine while they're in the hospital before they're discharged. You see your doctor if you've never met them before. Hopefully you had that engagement with them beforehand, but you'll see them once out of the hospital, once at 2 weeks, and maybe there's one there, and then again at 2 months, and you're having to decide whether or not to do this. So we're trying to have a public health policy where each decision is made on a personal level. So yes, it is a very hard process. From a public health standpoint, there is no question that these vaccines are incredibly effective at protecting the public health, at conserving the resources that need to be dedicated to health care. At the same time, the parents have to decide, here's what I'm hearing outside, here's what you as my provider are telling me about the benefits and the risks of this, and I have to weigh that out in a matter of a single office visit. And then it's a needle, and my child's going to cry. It's not easy. I've been there. I've got kids. It wasn't easy, and I was trained.
Ms. Taylor, I assume you probably agree with Dr. Flanagan that there could be a better public information campaign, but you might not agree with the content of that campaign. Is that true?
Yes, and I don't think it really, the problem is that all of these efforts to get people to raise vaccination rates, to join in this program, aren't working because people don't trust the program and they don't trust the people who are running the program. And they're not involving families. They've diagnosed the problem incorrectly and said, well, parents just don't have enough information. If we just tell them what the CDC thinks, that they will start vaccinating. But again, the problem is there is a great deal of corruption at the federal level. And I'll give you an example that is, it's kind of stunning that this is the case, but you can go on the CDC's website and they will say, you know, do vaccines cause autism? No, they don't. Here are 9 studies that show that there's no link between vaccines and autism. The author of one of those studies is a man named Paul Thorsen, and he's the head of the Danish research team that the CDC hired to answer some of these questions. If you type in his name and type in OIG and then Paul Thorsen, you'll be taken to the Office of Inspector General's most wanted list, where he's been indicted on 21 counts of fraud and money laundering charges and is currently awaiting extradition from Denmark to the United States because the Department of Justice wants to put him on trial. In 2012, the CDC representative appeared before Congress and was asked by a congressman, why are you still using this man's research? Why are you using the Danish research? Have you even reviewed it to see if it's sound? And they said, no, we haven't. And so parents look at that and say, how do I have a foundation of trust? And you're not answering the questions I have. I have a vaccine-injured child. I vaccinated. He falls under vaccine injury guidelines per the federal government, and you can't get I've never been able to get a doctor to properly evaluate him. So they've misdiagnosed the trust problem, and until they start clean up their own house, they're not going to have families that are going to respond to it.
Dr. Mills, before I get to this gentleman's question, one of the things we've noticed here at WGME 13, we're talking about vaccinating our current youngsters in this country. We want to certainly prevent any kind of disease. But one of the things we've noticed is that there are, according to estimates, as many as 11 to 12 million illegal immigrants here. There are requirements for official visitors, approved visitors, to have 14 vaccinations, or say 14 immunizations to enter the U.S. But we're not really aware of any kind of program that takes care of these 11 to 12 million, those who get apprehended. Should we be concerned about these visitors that we really haven't kept an eye on? Are they properly immunized? Because we're talking about maybe 90, 100, 200, 300,000 youngsters who are exempt. But what about those 11 to 12 million illegals? Is that a problem, or is it not?
Well, we live in an increasingly smaller world, And so we have Americans who travel around the world, and we have people from around the world traveling here. They may be immigrants, they may be tourists, and just like we sometimes immigrate or are tourists in other countries. So I think we can't look at one population and start pointing fingers, because it's really, we live in a global village in which we're always one flight away from some sort of vaccine preventable disease. So that's why we have assurances such as where our children go to school, where they go to daycare, whether they're here as U.S. citizens or they've immigrated to the United States, that if you go to a public school in the United States, or private schools even too in many states, or daycares, that there are some assurances that those people are vaccinated, for instance. So there are systems of assurance, but I think that's another reason that you point out why we all need to look at our vaccine status, because we all do, many of us travel, and we have a lot of visitors who come to the United States as well. So we are always just one flight away from a vaccine preventable disease.
And on a quick follow-up on that topic, there are diseases and infections and all sorts of afflictions, some of which almost on a global basis have been eliminated. Are there any kind of suspect diseases or infections or afflictions that we should be concerned about that haven't been eradicated, that there's a greater likelihood we could see that coming in from abroad? Because, again, we want to protect everyone here, but if we do have kind of an open borders, should we be concerned, or am I making much ado about nothing?
We are in an increasingly smaller world, really, with so many people. Within 12 hours, you can be in China now. So, you can be halfway around the world in just 12 hours from a flight in Boston. So I think we all need to be aware of the vaccines that we need to have in order to protect ourselves, and whether we travel or not.